Well, the state health department says the flesh-eating bacteria has so far killed 5 people this year. 4 others have been hospitalized.
Gabby Killett spoke with a local doctor who says that infection rates are getting worse over time.
The Louisiana Department of Health urges people to take precautions around coastal water and raw seafood.
These can be very aggressive.
With Vibrio vulnificus bacteria infecting and hospitalizing 9 Louisiana residents, 5 of whom have died. Health officials say that Vibrio bacteria occur naturally in warm coastal waters, but that they're more common from May through October when the water temperatures rise. Now, infection can happen, health officials say, when an open wound comes in contact with either saltwater or brackish water, like here at Lake Pontchartrain. The health department says all patients affected so far in 2026 had open wounds exposed to seawater.
The wound infection that can develop, the mortality rate, 15%.
Infectious disease specialist Dr. Fred Lopez says the risk is also in consuming raw or undercooked seafood, especially oysters.
Eat a raw or oyster and you're immunocompromised because you have cirrhosis of the liver, for example, and it gets into the bloodstream. 50% mortality rate.
Lopez points out all Louisiana patients so far have had underlying conditions. He warns anyone with such factors at play to be especially cautious.
Maybe they're taking steroids or receiving chemotherapy for cancer. Maybe they have kidney disease. Maybe they're taking acid suppressive drugs, stomach acid suppressive drugs.
He says oftentimes patients realize the bacteria's effects too late.
These infections can move very quickly. Oftentimes we need the help of our surgeons to help take care of those wounds and remove the tissue that's no longer alive but is infected. And sometimes these can result in amputations.
And that prevention is the best way to protect yourself, including by washing wounds after exposure.
You really want to eliminate the organism from your seafood, cook it. If you have a wound and you're going to be exposed to brackish water or seawater, put a bandage over it that's waterproof.
The Louisiana Department of Health says the cases are worsening. During the same period, the past 10 years, Louisiana reported an average of 7 cases and 1 death. Lopez says climate change is to blame.
Increasing the temperatures of seawater and seawater that normally wouldn't get to temperatures high enough to sustain the growth of this organism are getting warm enough to sustain the growth. And as a result, you're seeing infections in other parts of the country.
He says it's all the more reason to take precautions that protect you and your family. Gabby Killett, Fox 8, Local First.